is going to be about signs of preterm labor. I think it's really, really important for pregnant moms to know that as early as possible. As women, we tend to hide. I don't know if you've ever watched the commercial on TV where they have a woman who she feels she's having a heart attack. So she calls the 911 and they're like, okay, we're on our way. And she's like, can you give me 10 minutes? Because she was looking at her house. It's like she wanted to go clean her house. You know, we as women we do that. And I remember even reading where they said a woman is more likely to die choking than a man. And you know why? Because they say women go and hide. So having these signs is important because when you're feeling them as a mom, you'll know that these aren't right. And what I want you to do is I'm going to have information written below. I'll have all the stuff that I'm going to mention from this card below, and I will also have some links for you to go to. But I want you to show those signs to your spouse, to your mother, whoever is with you and who's going to be with you 99% of the time while you're pregnant. They need to know as well what those signs are, because you still might be questioning yourself, like, is it really this or is it really that? And if someone else that you know knows what those signs are too, they can be your confidence person who says, yes, we're going to go. So I'm going to go over these things, and I've already spent 3 minutes talking, but I think it's really important for you guys to know that as women, we tend to be afraid to say what we're feeling. We're afraid we're wrong. I don't know. There's so many things we as women, we will hide. And I think a lot of you women will agree that no matter what we do, if it's something that is important, we're afraid to, to get help for ourselves. I want to give you guys these tools. So I am using this March of Dimes pamphlet, and it is on signs of preterm labor. And so I'm basically going to use the information from this card, but I am going to put a link down below for their information so that you can go to their website, and possibly you'll be able to find, and I'm going to try to find the link exactly for this specific subject and make sure that you guys have something quick to go to, even if you have to print it and put it on your, your refrigerator. But please email me if you have any questions. If you need my help in any way whatsoever, please don't hesitate to email me. That's what I do. So I'm here to help you answer any questions or concerns that you have, as well as if you have a question, you can put in the comments below, and I will be sure to cover those. I will try to do it like right away. So I'm always watching, my channel, and I'm always watching the comments. So definitely, send me a question through that. If if it's personal, then you can do email. If it's not so personal, you can do it, through the comments below. So what you need to know. So it's really, really important as a mom, not to blame yourself. You can do everything right and still go into premature labor. So it's not necessarily something that you have done. Yes, there are higher risks, let's say, for somebody who smokes, but that might not be the reason that she goes into premature labor. And you might do everything right and go into premature labor, and she doesn't. So it's not really about what you do. Although, of course, we want you to change things like alcohol and tobacco and all that, because all those things are detrimental to your baby and to you, really, while you're pregnant. So definitely know that it doesn't matter. You can do everything right. So you cannot blame yourself if it happens. Now, what they consider as premature labor or premature birth, let me see how they put it, just preterm labor. Basically what that is any time, oh look, I have some hair flying away. Okay. Any time before 37 weeks is considered preterm labor. So at 37 weeks and to 40, it's considered full term, you're good. But anything before 37 is considered preterm. Now, for me personally, I had 2 at 34 weeks, and 1 at 35, and 1 at 36 weeks. So all mine were preterm. One of them had to stay in the hospital, but the others, were okay. But thank goodness for me knowing what the signs were, because I did actually go into labor. Every single one of mine, I went into preterm labor and had to be hospitalized at least twice. The last one, not so much, because they knew I was like that kind of, pregnancies. But I still ended up going in labor early with my last, and, going to the hospital, and they tried to stop it, but they couldn't. So doing everything right is not necessarily going to keep that. What you need to know is what those signs are. That's all you need to worry about, is knowing what those signs are. Now, what do you do when you think or you're seeing these signs? Because even just one of these things could be a sign. You may not have anything else but just one, and that still could be a sign of premature labor. So what will you do? What is the first thing you do? The first thing you're going to want to do is you're going to call your doctor. And I'm going to put that up here. You're going to call your doctor. You're going to let them know what you're feeling. If the doctor's office is closed, you want to call their answering service. Now, most likely, your doctor is going to tell you to do something like get up off your feet, rest for an hour on your left side, and then you'll call them back, that kind of thing. But you need to tell them exactly what you're feeling, because if there's anything you miss out, it could change the advice that he gives. He may want to send you directly to the hospital, but maybe you didn't mention something that you were feeling, and so he's going based on just one of those signs. So you got to make sure that you let them know completely what's going on and don't hide anything. And I don't mean that you're trying to hide it, but sometimes you can be embarrassed by something. Like if you saw blood in your urine, like you had like a mucousy blood discharge, you might be too afraid to tell your doctor that. But that is a sign of you're going to have that baby pretty soon, usually within 24 hours. So, I'm sorry, guys. I set my alarm. So definitely don't hold anything back, because it could change what his advice is. So, number one, contractions that make your belly tighten up like a fist every 10 minutes. So basically, or more often, that's what I was getting ready to say. Basically, anytime you get this tightening, and as you get farther into your pregnancy, they're called Braxton Hicks, and your stomach will tighten. But when it tightens so much, like literally every time you get up and walk, it's tightening, and it's where you have to stop and like maybe you hold your breath through it, or you grip something because it's so intense. That's a sign. Definitely you want to call your doctor and talk to your doctor about that. That is definitely a sign. And it may not come every 10 minutes. It might come every 30 minutes. But if there's a consistency, it's coming like every so many minutes, definitely call your doctor. Also, if you see a change in the color of your vaginal discharge or bloody discharge, definitely, I mentioned that. You definitely want to let the doctor know that, because that is a sign. I mean, it's typically, when you get that discharge, the baby's usually born within 24 hours after that. So I'm not sure. There's probably a way that they can stop it or slow it down some. So definitely don't miss out on that one. That one's very, very key. The feeling that your baby is pushing down, or you just feel heavy in the pelvic area. If it just feels really heavy there, and a lot of times it kind of hurts, like they're sitting on your pelvic bones, definitely let the doctor know that as well. Let's say you have a low, dull backache. So you're having a backache, and it's a lower backache. And some people all through their pregnancy, they get backaches. But this would be a little bit different. It's going to feel differently, and it may come on in like every so many minutes. It gets worse. So definitely, I'm saying definitely like every single thing. Stop saying definitely. Okay, so you want to call your doctor if that happens. The next one, which is number 6, cramps that feel like your period. This is a hard one too, because sometimes you feel like you're cramping like your period, and it's just ligament pain. It doesn't matter. Call your doctor, tell him what you're feeling, and again, think of all these other signs that are happening. But call him. If they say, just lay down, whatever they say, you just follow their advice, and if they decide for you to come in, you go in. If the doctor tells you to stay home and lay down and keep your feet up, but you just feel something isn't right, just go in. Just go into the ER. The worst case scenario, what? They tell you everything is fine. Definitely, if your intuition is telling you that something isn't right, just listen to it and go in. They say a mom's tuition is always right. And I remember every time I would feel something isn't right, honey, something isn't right, I will go in and I was dilated. So definitely, again, definitely, I'm going to just call this definitely. Okay, so definitely, oh my word. Oh. So call your doctor. Can't think of another word I should say instead of definitely. Okay. Belly, this is the last one, and this is, this is number 6. Last one was number 5. Number 6 is belly cramps with or without diarrhea. I went in labor like this with my 3rd, but I was 36 weeks with him. But I was getting up the whole night with diarrhea cramps, and I would get up and I would use the bathroom and I'd come back, and it didn't dawn on me until like 7:15ish, and I got up and I was telling my husband I was sick all night, and then all of a sudden, like, wait a minute, this is coming like literally every half hour, and sure enough, I was in labor. So if you have those belly cramps and you have diarrhea or you don't have diarrhea, you kind of know it's not period cramps. It's the cramps of like, okay, I'm sick to my stomach. I'm going to be going to the bathroom pretty soon. That's, that's the kind of cramps they're talking about. And the cramps that you have like for a period, they're much lower. And it is just where, and ligaments are in that area too. So if you feel it, you call the doctor and let them, check it. Like I say, the worst case scenario is what? They check you and everything's fine. I mean, there is no bad, negative thing to go into the ER if you feel something is wrong. So those are the 6 signs. I was going to say it. You need to call the doctor for sure, even if you just have one of these signs. And please, don't think that it's okay, it's just me, everything's fine. Just call the doctor, and if it means you got to go in and he does a stress test or whatever, you'll do that. I mean, right? Okay, so the last little point is what your provider might tell you when you call him. So I kind of covered the points where he will tell you to rest and maybe lie on your left side for 1 hour. They may tell you to drink 2 or 3 glasses of water or juice and not to drink coffee or soda. And they may tell you to go to the office or go to the hospital. And pretty much, if you do any of those things and it doesn't get better or go away, then you definitely want to go in. I said it again. You want to go in. I don't think I can not say this without using definitely. I'm just going to have to say it, guys. I have to use definitely. So you're going to go in whether, if you've tried all those things and it's still happening, you need to go in. There's just no you don't want to take any risks, you know what I mean? Okay, so that's it. I talked a lot. 16 minutes, and it was just a few points. But I just want you guys to really understand what those signs are and not to be afraid to ask and get help. It's really important. And this is the first class that I have my new background. I'm going to move over so you guys can kind of see it. So here is the different breastfeeding positions. So you've got the football, the laid back, the cross cradle, and the cradle hold. And I know it's kind of like not so easy to see, but, and then you got your line on your side here. But it's like, I think I could get good close-ups if I needed to. What I'm going to say is the cradle hold and the line on your side hold, those should pretty much be used like a little after you and the baby have gotten kind of used to breastfeeding, just because you have more control over the baby if you do the laid back or the cross cradle and even the football hold. if you do those, you'll have better hold of the baby and still have that hand free for your breast and adjusting. So that's why I mentioned that. And I'm just going to kind of point down. These are pictures of good latches. And I will do it up close one of these days so that you can see when we talk about it. I actually could just do it right now. So when we talk about it, I got to do it so that you guys can see it because this thing is so weird. Okay, so as you can see, the chest is, can you see? Yeah. So the chin is buried in the breast. You can see both the upper lip and the bottom lip. And then down below with the cradle hole, you can see the chin and the breast. Sometimes you may not see the bottom chin so much, but what you want to see is you want to see the lip like this, like it's, you know, almost like an A, like this. So you want to see that, but this isn't a class on that. So, and then the other side, I'll move a little bit, is colostrum and the feeding cues. So let me turn a little. So these are the feeding cues. And this is the stomach, the baby's stomach, and how much they can drink. Now, this, don't worry that you can't see it right now. If you want the picture like now, then comment and I will, you know, post it up for you. But I will do like a video separate on that, just because that's like a topic all in itself. And I forgot to mention this little diagram here, which again, I'm getting ready to do a video on everything you need to know before you go in the hospital, basically for labor, you know, right at labor. So I will go over this chart at that point in time. So I hope you guys enjoyed the class. I hope it worked with you guys. It answered questions and helps put you at ease. And you guys will see me in my next video. I am going to put out another probably 2 or 3 part video series. And again, that's going to be on everything you need to know before the baby's born, like right when you're going in to have your baby. So I will be working on those and trying to get those up by, I don't know, about maybe this weekend I'll finish. I don't know, but it'll probably be next week is what I'm thinking. So that's it, guys. I hope you have a great day. I'm sorry the video was 20 minutes long, and I really, really apologize. But I think you guys will enjoy it. It's information you know, that really helps. So, and you can always just like skip through it if it's annoying you. But anyway, if you get into this part, it means you stayed to the end, and I say thank you for doing that. So you guys have a great day, and I will see you again in my next video. Bye.